We're here at the Camarang District Hospital where major surgical procedures are being done for the very first time. The government, through the Ministry of Health, recognizing the difficulties faced by residents when traveling to Georgetown for such procedures, decided to establish a theater right here in Camarang.
My name is Elvis Hope of Region number 7 of Mazaruni. We appreciate that the team are here for the first time, and I am the first man to have this surgery. So we would like the team come again in the future so that we will be facing the less expense rather than going to Georgetown.
I'm from Paremo, but I'm living home at Waramdang, and that is where I came from. And many times I have suffered. I went to Georgetown. I couldn't find no fault in me, and only yesterday I had to find a fault that I was ill. I'm suffering with hernia yesterday, and had to end up going to get a surgery. And I'm successful. I'm glad everything is safe right now. Thank you for the team. Thank you for the doctors who you all sent across. So thank you for everything.
My daughter went under surgery. She was in Georgetown for checkups, and we were so worried when she went to Georgetown. And looking at the expenses, we had to worry. So when she was diagnosed as a positive gallstone, we went into the more like we were worried, and even the parent, the female parent of one side, like so. When she had the 2 little children, so we could know what to do. But when her clinic date was coming, we get more afraid of how to come about to offset our expenses to travel out from here to Georgetown to get the operation. So when I hear about these services coming to our district, I was very much happy to know that they were already here. So, and she was the first person or the first patient from the district to be the patient of the surgery, the technical outreach, and your facility is really appreciated.
This will not only alleviate the need to travel to Georgetown for surgical services, but also allow indigenous people to maintain their traditions and recover closer to home.
Well, I'm very proud because, as we know, this area is traditionally Amerindians, and persons being here in their home actually able to access surgeries, it's more comfortable for them because they can have that support of their family instead of going to town and being there with just one family member. You could have your extended family here with you, and as we know, Amerindians are very traditional people, so it's necessary for them to be close to home. They can get the necessary diet and keep up with their traditional ways of handling after surgeries.
Doctor in charge of the district hospital, Dr. Mark Allen, also emphasized the significance of this latest development.
I think everybody here feels pride that this thing is operating and that people are literally benefiting from it. I'm glad that the first patient that was operated from wasn't even from Camarang, it was for a far-flung area as well. We've managed to have people from Philippi, from Parima, from Waramadang, from Kaku, and right here from Camarang as well to have their operations done. The thing is that it's difficult for the average person to go from the interior into Georgetown. It's not their culture, it's not their language, it's not their diet. The average person, they can't see the family, they don't know what's happening, there's little to no communication. Because in the interior, there's little to no communication to the outside. I was so happy to see here that the first patients that came out of recovery were able to go into the arms of their family. You could see the happiness that they had.
Approximately $50 million was invested in the construction and furnishing of the surgical theater, which has become an essential addition to the hospital's medical facilities.
One of the promises made by His Excellency President Irfanali and the government of Guyana is that we are going to take health care to the people. That the people of the hinterland should not have less access to health care than those on the coast. And this is one such project that meets the demands of the president to fulfill that promise. At a cost of over $50 million, this facility was constructed and equipped to provide surgical capacity to Camarang, which is the hub of all the facilities where Amadong, Philippi, Joel, and so around the area. So it caters to all the population here.
A series of projects aimed at bridging the healthcare gap and providing accessible and affordable healthcare services to everyone has started. As part of these efforts, surgical capacities have been introduced for the first time in several hinterland villages, including Maruca in Region 1 and Aishalton in Region 9. Plans are underway to establish additional surgical theaters in other villages as well. To cater to the healthcare needs of the hinterland regions, several regional hospitals such as the Mabaruma, Lethem, and Paramakatay have been transformed into smart hospitals, enabling the provision of a greater range of healthcare services. Moreover, telemedicine capabilities have been introduced into 25 hinterland health facilities across the country, with more sites to be added in 2024. State-of-the-art hospitals are slated to be constructed in Maruca Region 1, Camarang Region 7, Cato Region 8, and Lethem Region 9. These initiatives are set to revolutionize the healthcare landscape of Guyana and provide better healthcare access to the remote areas.